Aster Women and Children's Hospital. I also have a special interest in pediatric rheumatology. It's a branch which deals with autoimmune diseases in children. However, today I am here to talk to you all and to educate a bit on a common tropical infectious disease in children, which is known as enteric fever, or more commonly what is called as typhoid fever. So we do see this quite commonly in the tropical countries such as India, Pakistan, Bangladesh, and also some other Southeast Asian countries. It is not such a common infection in the West, and it is caused by a bacteria called Salmonella typhi, and it may also be caused by Salmonella paratyphi A and paratyphi B, which are also the Salmonella bacteria, and these are spread through the fecal-oral route. That means the bacteria is shed in the feces, and when there is either due to poor hygiene or poor sanitation, if there is contamination of water by sewage, then these bacteria can enter into the gastrointestinal tract through the oral route, and then it multiplies in the gut and causes a typhoid fever. This is commonly an intestinal infection, and it comes with symptoms of fever, vomiting, diarrhea, abdominal pain. Sometimes there may also be symptoms such as cough or bronchitis. There may be headaches. Very rarely there may be more serious conditions such as fits or coma due to the high fever or the severe infection. And if not detected in time and not treated in time, then it can lead to other complications also. So in children, we see this in the age group of 2 to 6 years, but it can be seen even in infants, and it can be seen even in older adolescents and adults. So the commonest route of entry, like I said, is the fecal-oral, and it can happen due to improper sanitation facilities, but it can also come through contaminated food and water. Something like eating sweets at a sweet shop, or ice creams from the local ice cream cart cooler, and because the bacteria can thrive even in this cold condition, and it can multiply, and that can lead to infection. So even though in cities sanitation and sewage contamination is not so much of a problem, we see it sometimes but rarely, the food contamination can happen, and that acts as the source of infection. So in children we may see it as only a fever, and it is typically what we call a step ladder pattern of fever. The fever may not be so high in the first 2-3 days, then goes on increasing day by day, and it may continue even for weeks if not detected in time. So if we see any child with a high fever for more than 3 to 4 days, with symptoms of vomiting, diarrhea, headache, cough, or without any other symptoms, only fever, we do work up the child for typhoid fever. So the investigations, commonly the complete blood count will show generally a leukopenia, that means a decrease in the white cell count. It may show a decrease or a normal platelet count. The C-reactive protein may be normal or elevated, but the most important test is what is called the blood culture, which helps to pick up the bacterial growth of Salmonella typhi or paratyphi. And this test takes about 2 to 3 days for the reports to come. And this has to be done ideally before any antibiotics are started. Otherwise, there is, as much as if we do it without before any antibiotics are started, it may be positive up to the rate of 90%. If it is done after antibiotics are given, the positivity rate drops to almost 40%, and then it may be difficult to get a diagnosis. There are other tests such as the Vidal tube test and the Typhi dot test, but these are non-specific and generally not really advised for the diagnosis of typhoid fever. So the Vidal test can be done under specific circumstances. Suppose the child comes with a fever of more than a week and then there's no diagnosis and antibiotics have already been given. Then the Vidal agglutination test may help. They will look at what is called O and H titers on the Vidal test, and anything more than 1 in 160 would be taken as positive, and especially if there's a rise in the titer after another week, then that is more confirmatory again. However, that is not practical always. We are looking at immediate diagnosis, prompt treatment, and we want to get the child better within a day or two after seeing the child. We can't wait for another week to repeat a Vidal and confirm the diagnosis. Hence, the importance of getting a diagnosis before starting antibiotics. Many times parents are under the impression that a fever, we need to give antibiotics immediately to treat it. But this is more counterproductive, more harmful, and then we are left floundering without a diagnosis if they come after 2 or 3 days of giving antibiotics. So I request all of you who are watching this to give just paracetamol or any other fever reducing medication for the first 24 to 48 hours of fever if child is otherwise well. And if the fever is rising even after 48 hours or there are other symptoms, then do take the child to pediatrician, get the child examined, investigated, and then only if needed antibiotics are to be started. If it's simple viral infection, the child will have high fever right on day 1, day 2, but by day 3, 4 we should see the fever spikes coming down, and those children do not need antibiotics. When we examine a child whom we suspect may have typhoid fever, we may or may not find any signs, any localizing signs. The chest may be clear, the stomach may be soft, there may be enlargement of liver, spleen, which are the organs in the abdomen, or there may not be any enlargement. Sometimes the children have so much vomiting and diarrhea that they come with dehydration. So sometimes the high fever may cause seizures in children. And sometimes these children may come with what is called signs of meningeal irritation. That means the irritation in the covering of the brain, the meninges. And that leads to symptoms of headache, severe headache, vomiting. And when we examine the child, we find the signs of meningeal irritation. This is also a known thing with typhoid fever. So it is, although it is something that is well known in the community, it is not easy to diagnose all the time, and especially when it occurs in infants, it may be more difficult. Hence the importance of sending off a blood culture at 48 hours of fever or even earlier if indicated before starting antibiotics, and starting the baby on this oral or intravenous antibiotics. So depending on the condition of the child, we decide if child should get oral or intravenous antibiotics. So if child is well, otherwise taking orally and not dehydrated, does not have much vomiting, diarrhea, is only a running fever but controlled with oral medication, can be at home, we can send the investigations and start the baby on oral antibiotic such as cefixime. However, if the child is running high-grade fever spikes, is vomiting, is dehydrated, more toxic, and fever has been there for more than 4 to 5 days, then it is preferable to admit in hospital setting and start on intravenous antibiotics. So only if the first line of treatment is ceftriaxone, which is a commonly used broad spectrum antibiotic for typhoid fever, and this works in most cases. If there is a culture positive diagnosis of typhoid fever not sensitive to these antibiotics, then second line antibiotics need to be considered, which the doctor will decide accordingly. So we expect that after starting the correct antibiotic, within 2 to 3 days, we should start seeing a decrease in the fever spike. It does take long time sometimes. And whenever the bacteria is released in the blood, the child may show the symptoms of chills, rigors, that is severe shivering, and a fever spike. So, but within 24 to 48 hours or 72 hours, we should start seeing a decrease in the fever spike, a defervescence of the fever. child should start feeling better and start taking orally, the appetite should improve. The duration of antibiotics is longer in typhoid fever than for most other common illnesses. It has to be given for at least 7 days after the fever has gone, or a minimum period of 14 days. Okay, so this helps to prevent relapse and reinfection. Otherwise, the bacteria may remain dormant in the system and there may be a relapse of the infection. Complications we do see rarely. If it is not treated in time, it can lead to an intestinal abscess. It may lead to a peritonitis, that is infection of the the cavity, peritoneal cavity in the abdomen. It may lead to sometimes meningitis, a severe bronchitis. So these can be prevented by prompt diagnosis, adequate treatment, correct duration of treatment is important. And coming to prevention, so we have the typhoid vaccine, which has been there now for many decades. Earlier the oral vaccine was used, then the VI polysaccharide vaccine was used, but that could be given only to children over 2 years of age, and it had to be repeated every 3 years as the immunity waned after 3 years. But now we have the typhoid conjugate vaccine, so which can be started even as early as 6 to 9 months of age. Because this illness has been seen in children, infants and young children, there was a need to start off the typhoid vaccine even before 2 years of age. Hence, this vaccine is safe, and as of now, the evidence says that even a single dose given by 9 months is sufficient, and booster doses are not necessary for the typhoid conjugate vaccine. It is effective in prevention of typhoid fever. Sometimes we have mothers coming with questions like, "Doctor, I have been diagnosed with typhoid fever. I am on medication, antibiotics. Is it safe to breastfeed my baby? Will the baby get infection from me?" So it is safe to breastfeed even if you are diagnosed with typhoid fever and are taking antibiotics. If you are able to breastfeed, you should definitely go ahead and breastfeed your baby. Baby will not catch infection from mother's milk. In fact, gets protective antibodies from mother's milk. So although typhoid fever has been a well recognized infection for many decades, it is it is important to know that we do still see it quite commonly. The symptoms are non-specific. There may be only high fever. It is not easy to diagnose unless suspected, and it needs to be thought of in any child with fever for more than 3 days, not immediately on day 1 of fever. Many times the mistake what is made is a Vidal or a typhi-dot test is done on day 1, day 2, and as that is positive, the child is started off on treatment for typhoid. So more often than not, we are actually stopping the treatment once we are sure that this is not typhoid. So we should not go by the non-specific tests such as typhi-dot or Vidal. That should be done only as a supportive evidence if needed, and a blood culture needs to be sent off before starting antibiotics for typhoid fever. Vaccination is available and should be done for all children, and adults also can take the vaccine. Prevention is by maintaining good hygiene, strict hand washing after using the washroom, after cleaning babies' stools or the urination, disposing of the diapers properly, and preventing the water contamination, avoiding eating outside food from unhygienic places, or the cold ice creams sold in the carts, etc. And by vaccination also is the most effective way for preventing this infection. So this is something that I thought is useful for the common man to know about typhoid fever or enteric fever, because it becomes quite an important cause for morbidity, for hospitalization in children, and just a simple awareness can help in preventing and in early diagnosis if child has the symptoms. Thank you. Bye.